Are you worried about vitamin deficiencies? Maybe you're thinking you might have some sort of disease process or problem occurring due to vitamin deficiencies. My name is Dr. Terranella, and in this video, we're going to look at some specific diseases that are caused by vitamin deficiencies, things like beriberi, pellagra, rickets, and several others. Again, my name is Dr. Terranella, and if you're new to this channel, I just want you to know that I'm making these videos to help you go beyond the basics of your health. Whether it's a confusing lab test, symptom, or diagnosis, I make these videos to help you get a better understanding of what's going on with your health. So if you like this kind of information on nutrition, health, hormones, etc., click on the like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's check out these diseases due to vitamin deficiencies. Many people don't even know that you can actually get severe enough vitamin deficiencies where your body really starts to break down. These are the diseases due to vitamin deficiencies. There's several vitamin deficiencies that maybe you've heard of that can lead to diseases such as this, but we want to discuss them here in detail. And then we're going to have follow-up videos on each of them and look in more depth on what some of these vitamins do and some of the presentations that may show up when you have these types of vitamin deficiencies. So I wanted to point out here before we go into each one is that some people can have more subtle presentations of each of these. We would call it like a subclinical manifestation of some of these disease states. So as we look at each of these diseases due to vitamin deficiencies, be sure to consider a more subtle variation of that may be manifesting in yourself. This is especially true if you have ongoing symptoms or problems that seem to overlap and you and your doctor are having trouble figuring out what it is and what's going on with you. And again, I'm going to do more in-depth videos on each one of these and break into some of the subclinical manifestations that may present. So here are the diseases due to vitamin deficiencies. Number one, a lot of people probably heard of this, scurvy. So scurvy is caused by a deficiency of vitamin C, and some of the symptoms can include things like weakness, muscle pain, easily bruising, bleeding gums. Severe cases can even lead to actual gum disease, joint pain, and even death. Another one is rickets. Rickets is caused by vitamin D deficiency and can result in weak and soft bones. It's most commonly seen in children who don't receive enough sunlight or have a diet lacking in vitamin D. Beriberi is a deficiency caused by thiamine or vitamin B1, and symptoms can include weight loss, confusion, muscle weakness, and even heart failure. And there are different forms of beriberi as well, which again, we'll go into in more depth when we do a separate video on that topic. Pellagra is caused by a deficiency in niacin or vitamin B3. Symptoms include skin rash, diarrhea, and even dementia in advanced cases. Night blindness is another one, and this is caused by vitamin A deficiency and can result in difficulty in seeing in low light conditions. In severe cases, you can be completely blind if you don't have enough light. And then the last one I'll note here is anemia. Of course, anemia I don't think of as necessarily a full-on disease state, but that can result from not having enough B12 or folate, and symptoms can be weakness, shortness of breath, and of course, fatigue. So all these things can't happen from simply having a deficiency in these vitamins. And we're going to look at some of the presentations, some of the genetics, some of the dietary things that may lead to deficiencies in these vitamins. So how they do? Did that give you a better understanding of diseases due to vitamin deficiencies? Hopefully it does. If you have a question on any of these topics, drop it in the comment section. Thanks again for watching. We'll see you next time.